Assalamu alaikum to you, Dr. Ahmed Bhyat. Welcome to the program.
Wa alaikum salam. Jazakallah for hosting me. Just a bit of a correction. I'm not head of operations. I'm head of surgery at Robert Mangaliso Sobukwe Hospital, previously known as Kimberley Hospital.
Okay,
To ask about,
Jazakallah for that. Jazakallah for that correction. We do apologize for that little oops. How
no
did this
problem.
all come about, and how involved were you in negotiating with Imtiaz Suleiman from Gift of the Givers regarding this issue? I just think it's mind blowing. Alhamdulillah.
Oh, this goes back a good few months, if not years. What's been happening is that there's been a chronic shortages of anesthetists, of nurses, and where we used to have 4 lists a week to operate, it was cut down to 1 week, one list a week, sometimes one list in 2 weeks. And since COVID, the numbers have just been increasing. We've had patients in the ward up to 4 months waiting for operations. And I'm not talking of lumps and bumps, I'm talking about cancers, cholecystitis, big operations.
So
And
sadly, Dr. Bhyat, I should imagine that you lost several patients during the wait as well,
yes,
because
that is
there was
true.
just no ways you could help them, and then and that is so sad because you do know with the right and timeous interventions, those patients could have been saved.
Yes, besides that, my team and myself, as my fellow consultants and my medical officers, I mean, imagine having to walk into ward day after day, looking at the patients in the face. They ask you, when am I going to be operated on? And you don't have an answer.
Mm.
And that was very, very frustrating. And then in desperation, I found Imtiaz and I said, Imtiaz, I need help. And what is amazing is that within minutes after Imtiaz put up the request on the group, we had responses from a wide range of professionals willing to come down. And eventually I had to say, sorry, I just need anesthetists and I need nurses. And
Wow.
within the space of 1 week, it was arranged.
Alhamdulillah. This
So,
obviously talks directly to the inefficiency, I guess, carelessness of local and provincial and even national government for not getting the house into order, because we pay our taxes and our taxes are supposed to be having all of these services and personnel in place. And it's a crying shame that this is the length that we need to go to assist people in absolute dire need. But Alhamdulillah, that you took the initiative, and together with the support of Dr. Imtiaz Suleiman and Gift of the Givers, something amazing has happened over this past weekend. Tell us what exactly did happen and how many operations you were able to perform.
the first group of nurses from Cape Town came down the Thursday evening. We brought them to the hospital. They had a look and they had a plan for the next day. The anesthetists came down the Friday morning. We started at 8 o'clock Friday morning. We ran 2 theaters. We worked up to 9 o'clock that evening. Saturday, again, we started at 8. We worked right through till about 8 o'clock. And on Sunday, once again, we started at 8 o'clock. And the anesthetists had to leave by 3 o'clock. In that time, we did 72 procedures. Now,
Alhamdulillah.
take it that a procedure takes about an hour, and that's about 72 hours of operating. It's
Sure.
a lot of work.
Mm.
And what I'm trying to get at is that if you have the will to do something, it's going to happen. And this team of nurses and anesthetists that came here were excellent, phenomenal. And, the sad thing is that you spoke about it briefly, that the state and the province Department of Health is failing us. It's obvious.
Mm. Mm.
from my side, if we are given the tools, if we're given the equipment, if we're given the opportunity to work, we will work. And we've showed it this weekend that we can work and we will work as surgeons. But we don't have the facilities, we don't have the backup, the assistance to do our work. And that is what's so sad. And at the end of the day, it's the patient that suffers. I go to my house every evening and I go to sleep. Those poor patients lay here in the hospital. Their families are suffering. Their kids are without a mother. It's heartbreaking when you know you can help them, but you are unable to help them. That is what's so frustrating. And
Okay,
it's not only here, it's all state hospitals.
absolutely. Yes, we are aware of that. Unfortunately, sadly, that is the sad reality in our country. It seems as if all state institutions are absolutely broken, through corruption, inefficiencies, and just downright carelessness. Dr. Bhyat, Alhamdulillah, you have set an amazing precedence. Where to from here? Because you guys worked on 72 patients over this past weekend, and undoubtedly you are going to get calls from absolutely big-hearted, uh, you know, uh, health professionals from all over the country wanting to pay it forward, as we as Muslims know that we have to be in service. And I'm certain it's not only Muslim doctors and health professionals, there are also non-Muslims that would want to give of their time for such worthy causes, not only at your hospital, but let's hope that this is going to be replicated throughout the country, because you have indeed shown that it can be done. Where to from here?
Which from here, my appeal to the Department of Health, provincial and national, let us work together. We need to fix up this broken train. We need to fix it up. There are a lot of people that are ready to help and to assist. My biggest fear is that if we carry on like this, where Imtiaz comes in with gift of the givers or other organizations, we're taking away the burden from the state. Burden that the state has got to see to. They're getting the funding, but the money is going to the wrong people and the wrong places. That has got to stop. We need to put our resources back into the hospitals. We need to get a culture of dedication, of working, of increasing productivity amongst all health professionals. That is where we've got to start. The Department of Health has got to take over this thing again. We cannot allow the Department of Health to abdicate its responsibilities.
So,
What
Dr.
Imtiaz
Bhyat,
is
have
doing,
you
yes,
carry on, please?
what Imtiaz is doing is phenomenal. It's excellent. But
Hey,
it's not
what you're doing,
sustainable.
what you've done is also phenomenal. Alhamdulillah. You're talking about being in a partnership with the Department of Health. Do you not think that you are going to be sidelined with a lot of red tape? That they'll just shirk their responsibility and not want to engage and not want to take responsibility in this matter?
But that's what's been happening over the years. And that's why in desperation, I came to Imtiaz. I mean, it's not that we didn't try. We've been trying. We've been pleading. Guys, we need help with our patients. Please come to our system. And in desperation, I went to Imtiaz.
Okay, we need to keep this story alive and ongoing in the media, and only then will we be able to hold these people to account, these corrupt politicians and government officials. We need to keep the story alive all of the time. I spoke with someone yesterday about another institution, a state institution which has failed dismally. And I kind of asked the question, perhaps we need to start taking legal action against the heads of the different departments at the Department of Health and such institutions. Only then perhaps we'll get action out of them. But I do know that that is the extreme route. What's your next plan of action in terms of, obviously it doesn't stop after this weekend. Obviously, there is still a need for ongoing operations. How are you moving forward on this for your hospital
Well,
in particular?
it's a difficult, I don't know how to answer your question. Already, the beds that we vacated over the weekend are being filled up. So by the end of this week, by next week, we're back to square one again. I'm not saying that what we did this weekend is fruitless, because there's 72 patients that are sitting at home now that have had the operations done, that are back with their families, and that I think is great. But it hasn't solved the problem in the hospital. And that is the crux of the matter. That is the bottom line. We need to fix up our hospital. And unless the politicians and the guys on the top come to the party, we're not going to win.
So, Dr.
And
Bhyat, Alhamdulillah, you've managed with this amazing support team, you've managed 72 operations over the weekend. What happens with aftercare of those particular patients? And inshallah, you probably are going to, carry on with this initiative, be it on a, once a month or once every 2 months basis, for now till the Department of Health gets off their hands, stop sitting on their hands and doing something. You will still see that there is this meaningful intervention in place. But what happens about aftercare? Is the hospital sufficiently, able to assist with aftercare of these patients?
aftercare is not a major problem, in that they come back to our outpatients clinic, which we man. And yes, we will see all of them in our outpatients clinics and treat them appropriately. That's not a problem. That is sorted out. So whatever is in our hands, whatever we can do as the Department of Surgery, and I must say, it's not just me, it's my whole department, my fellow consultants, my medical officers. I have a fantastic team, and we work as one. And that is what makes a difference. And yes, we will follow up these patients. We will see to them if there's any complications. We will sort them out.
Okay, when is the next marathon surgery weekend, inshallah? It's so sad that we're having to talk about this and having to possibly put you and your team under pressure, and to ask, because now you have set a precedence, have you not? And people are going to expect the next session or the next such, weekend of operations to happen sooner rather than later. And this is all an interim situation, an interim solution till the Department of Health steps up its game and makes all of the resources available to not only your hospital, but to hospitals throughout the country.
Well, my CEO has indicated that they're trying to arrange something in November, towards the end of this month, not just for Department of Surgery, but for all the surgical disciplines, a full week. So yes, so we'll hold on and wait till the end of November to see what transpires, if anything happens at all. If that happens, alhamdulillah, fantastic. But we'll wait till the end of November. If nothing transpires, unfortunately, it's December. But then early in January, we'll try and get something going again.
Inshallah. Your message to other healthcare professionals listening in this morning, and also undoubtedly our corrupt politicians are also tuned in. What's your message to the two different parties on the show this morning? Dr. Bhyat, have we lost you? Are you there?
No, I'm still here. I can hear you. My message to my fellow colleagues: let us all stand together, put our shoulders to the wheel. At the end of the day, it's for our patients and for the pleasure of our Creator. Whether it's Muslim, non-Muslim, it doesn't matter. We all have the same endpoint, same goal. It's for our patients that we're doing this. To the politicians, my plea is, please stop stealing. Stop enriching yourselves. Put the money back to where it belongs, for the poor of this country. The rich will take care of themselves. They've got the medical aids. I don't care. They will take care of themselves. It's the poor people. It's the poor that cannot afford private health care. The downtrodden people of this country. Think about them. stop thinking about yourselves. You're getting your salaries, that I'm talking about the politicians. You're getting your salaries. Put back
And
the money.
it's fat cat salaries anyway.
Yes. So if we can only stop the corruption and the stealing, we'll have a fantastic country. That's what I
Absolutely.
say.
Absolutely. I can't agree with you more. Dr. Ahmed Bhyat, head of surgery at the Robert Mangaliso Sobukwe Hospital in Kimberley. What can I say? What can I say to an amazing feat to you and your team over this weekend, including Dr. Imtiaz Suleiman and all of the volunteers that got involved over this weekend? It was absolutely mind-boggling. May Allah subhanahu wa ta'ala accept all of your efforts.
Amen.
And may those corrupt politicians be shamed, at what you were able to achieve together with your teammates over the weekend. And inshallah, we will follow the story and keep it alive in the media, so that as much attention can be featured on this and those politicians, and hopefully they can be shamed into doing the right thing. But may all your efforts be accepted. Jazakallah for
Amen.
talking to us this morning. Assalamu alaikum to
Jazakallah for
you.
calling me. Wa alaikum salam.
Rejuvenating media day by day. This is Salam Media.